Hi, everyone. Welcome to our Eating Disorder Hope Google Hangouts. We are so privileged to have Ms. Jeannette Rojas with us this evening. She is the program director at Rebecca's House, a treatment center here in California. So Rebecca, thank you so much for joining us, Jeannette. We're so glad that you could take the time to be here with us.
No, thank you. It's a pleasure to be able to speak with you and with the audience.
Thank you so much. So today we're going to be talking a lot about bulimia and just effective treatments for bulimia. But just to get started, can you maybe just tell us a little bit about yourself and what is your involvement in the field of eating disorders and just maybe some current work experience that you have?
Sure. I'm a clinical psychologist. I was born and raised in Mexico City. That's where I study.
Mm-hmm.
I also was interested in addictions. And it's interesting also that my work started with research, actually, with rats in a lab.
Oh, wow.
And then I decided I would like to start working with people.
Mhm.
So I work in a treatment center for substance abuse and for many years in psych hospitals a lot as well. And somehow one of the persons that I was working with decided and asked me if I thought we could set up a treatment center for eating disorders in Mexico, which I did.
Wow.
And for 7 years was a great experience. And I end up coming to the States 10 years ago, coordinating a program for that time. And then one of the places that I used to refer a lot was Rebecca's House.
Mm.
And I really like it and like their program, the philosophy. Have always been involved with eating disorders, substance abuse, and trauma. And
Wow.
that's how I end up in this field.
That's wonderful. And it's just so amazing to have clinicians like yourself who are very dedicated to serving the individuals and families who are struggling because, I think sometimes being in America, we think of it as just an American issue, eating disorders, but they're a global issue and they affect people all over the world.
Absolutely.
So it's great to hear that your involvement in Mexico, helped so many people while you were there.
Thank you. And, I think sometimes people don't believe that we have the same amount of people struggling there with eating disorders, but the percentage is really, really high.
Absolutely. And I think there is a big misconception that, Western media and things like that are the only factor that influence eating disorders, but we know that there's multiple factors, including biological factors and genetics that make a person susceptible. And it doesn't really matter what culture you're born in or what your race or gender is, you can still be vulnerable to developing an eating disorder. So
Absolutely.
yeah, we appreciate your work and just your expertise in the field.
Thank you.
And just kind of a follow-up question to that, what do you think motivates you to stay in the field of eating disorders? I mean, you've worked in this area for a really long time, and what kind of drives you to keep going? Because it's definitely a challenging area to work in.
I think exactly what you just mentioned, the challenge. I really like to work with eating disorders. I think it's my passion to see somebody changing. I think they're complex diseases and complex clients that most of the times have eating disorders and other diagnoses,
Right.
disorders or substance abuse or trauma. I think they are really bright and most of the times know more than sometimes clinicians. And I think all of that makes them unique. And I can imagine working with other population. I think is incredible gift to be able to provide services for this population. For me, I have passion for this. So
awesome. Well, thank you so much for sharing that. We're going to segue into our topic for this evening about bulimia. So can you maybe just explain a little bit to our audience and viewers what exactly is bulimia? I think there's a lot of misconceptions about what this mental illness actually is, and maybe just some of the diagnostic criteria that is used for someone with bulimia.
Sure. Bulimia is part of the eating disorders. Um, and what I'm saying with that is that people can have sometimes periods of anorexia, sometimes periods of bulimia.
Mm-hmm.
When you talk about bulimia, the clients or people can eat in a short period of time, most of the times less than 2 hours or 2 hours, a large amount of food, more than would be a normal amount that somebody will eat.
Mm-hmm.
Um, Another symptom that is very clear is the sense of lack of control. This sense of I cannot stop eating even though I want to.
Mm.
Another thing that we see with people who have bulimia is compensatory behaviors. And we call that compensatory behaviors. And just as the name is, we compensate the amount of calories or the intake. And the compensatory behaviors can be laxatives, could be diuretics, could be exercise, or purging.
Mm-hmm.
Um, Another thing that, or another symptom that people with bulimia might have is this dissatisfaction with their body image and low self-esteem related to the body image. Um, So it's part of the eating disorder spectrum, is one of the categories that somebody would have or could have, and really difficult at times to detect or to identify or diagnose.
Absolutely. And I think a lot of individuals who might suffer with bulimia may think like, oh, my symptoms are not that bad, or, like if I only like purge every so often, then it's maybe not a full-on eating disorder. So what criteria kind of makes it something that is really a diagnosable, disorder of bulimia?
I think when it's affecting important areas of their life, when medically speaking, they're compromised or they're starting to feel some effects, is what I said before, I mentioned before, is hard to diagnose because people can be in a normal weight range or a little bit
Right.
above. So, like, just seeing someone, you can diagnose an eating disorder, especially bulimia, because a person might look normal
Mm-hmm.
or in a normal weight range. Another thing that happens is that when somebody purge, they're gonna have electrolyte imbalances.
Mm-hmm.
There's no way to diagnose that unless I do a lab work, right? And I see your labs and I could see what is happening with you. Most of the clients, some of the clients, are really high achievers, very good in sports, really great in school, and that is probably an obstacle to diagnose because
Mm.
family members and clinicians might appear really together or really accomplished. Um, One of the other things that at times we do in diagnosis, or a professional that can diagnose really easily, is a dentist. You know, a lot of problems with cavities, loss of enamel. Um, However, I find that is really difficult at times for a dentist to confront the client and say, hey, do you have a problem with bulimia, right? They are the dentist, they are not the therapist. Obviously, in order to diagnose beyond labs, we're going to do an evaluation and
Mm-hmm.
we're going to talk to the client, which, as you were saying, sometimes they are going to minimize their symptoms. They are going to think it's not as bad.
Mm-hmm.
Uh, and that represents a problem. We know that they might minimize their symptoms.
Right.
Um, Another thing that can happen with bulimic patients is, and especially if they are using diuretics or laxatives, is dehydration,
Mm.
because they're gonna lose a lot of water.
Mm-hmm.
Problems with their heart. You know, you were mentioning, well, some of the clients might say, this happens just once. I'm not as bad. Well, it's very difficult to figure it out or predict when somebody is going to have problems with their heart, when the
Right.
heart is going to stop. It's not measured really by the amount of times you're purging. It depends on your electrolytes. When somebody purges, they're going to lose a lot of electrolytes, but part of that is they're going to lose sodium and potassium, which is what your heart needs to work.
Mm.
The heart will stop. That's the biggest risk also we have with bulimic patients.
Mm. And that's really scary, I think, because, like you said, someone can be really high functioning and be doing really well with their career or school and have that outward appearance like everything's okay. But I think that's the danger of bulimia, that there's a lot of very severe medical risks that can be occurring inside the body that they would never know.
Absolutely. Absolutely. There are times that labs might be okay, but if you check
Mhm.
their heart might not be okay. So blood work might be pretty normal. However, most of the times we see abnormal labs.
Right. So, kind of, going into these medical complications that you mentioned, since it is such a complex disease with a lot of issues that do need to be treated, not just medically, but, psychologically, you mentioned that there's often co occurring issues with eating disorders, like you'll see trauma or addiction. So, given all these complex factors, what have you seen to be the most effective treatments for bulimia?
I think when we are treating the whole person, I don't think, I think it would be very difficult to treat bulimia or any other eating disorder just by itself, like in a private practice. Having said that, there are people who do private practice and treat some clients. When clients are really compromised, they really need more support.
Mm-hmm.
So what we do is that, first of all, treat them in a treatment as a team. So that means we're going to address the medical complications. We're going to address the family situation of family dynamic. We're going to we're going to do psychotherapy. We're going to do, or most of the times, DBT would be part of the psychotherapy. We're going
Mm-hmm.
to have a psychiatrist address medication. There are some times that the psychiatrist will prescribe some medications that might help with cravings in order to stop the binge and purge. Um, the main thing we do in treatment is to stop the symptom, or try
Mm-hmm.
at least to stop the symptom. Sometimes it takes a while for them to do so. But interruption of the symptom, that's the first thing that we're going to do. And for that, we need a team around. It's not as easy, obviously.
Absolutely. And you can see why it's such a collaborative effort, or a collaborative effort is needed, because, there's so many different issues like nutrition and, like you said, psychiatric things and having therapy. I mean, having a clinician that specializes in each of those areas and working together as a team seems to be very effective.
Right.
Jeannette, can you also explain a little bit about the different levels of treatment that are available for someone that is struggling bulimia, and how would somebody know what level of treatment might be most appropriate for them?
That's an excellent question. One of the things is that first we do an evaluation, right? Every person that comes in, we're going to evaluate that, and then having seen the labs and the intake and all the information, we determine, can we treat this person? There are times that depending on the labs, the person or the client might need medical attention,
Mm-hmm.
up for them to go to residential level of care. There, or inpatient. There are times that the client can do extended care. which is a lower
Okay.
level of care. Another option might be partial hospitalization, it's called,
Mhm.
and the other one will be intensive outpatient. The difference
Okay.
in the level of care had to do with the amount of supervision, the amount of hours that they are in the program, the clinicians that they see on individual basis, the frequency.
Mhm.
And so basically, depending on the level of care, we have a little bit less supervision depending on what the client needs.
Right. So definitely for someone with more acute symptoms who needs more supervision, you would want them, at a higher level of care, like residential.
That's correct.
Okay. That definitely makes sense. Thank you for explaining that. And I think another question that we were hoping to just hear your expertise on is, what encouragement would you offer to someone who's struggling with bulimia and just really on the fence about treatment, or even for family members who may recognize that a loved one is struggling with this disorder? But like you said, some patients are just really in denial about what's going on, and it can be hard to make that first step towards treatment. What encouragement or feedback or advice might you share with a person who's dealing with that today?
I would say don't wait. I think that's
Mm,
the advice. Don't wait. Even though you think you are doing better, even though you think you can do it alone, you don't have to do it alone. So there's
mm,
a lot of professionals um, that can help, that can make this process less painful, that can
mhm,
help recuperate the life, your life, or hope if you have
mm,
lost that. For family members, again, do not wait.
mm.
Is not the best answer. It's a huge risk, and people die from this disease, right? That's something that we is hard to accept, but that's the truth. A lot of people die from this disease, and
Mhm.
I would say do not wait. That's the best advice that I would say. And there's always hope. Always there's a way.
Absolutely. And I'm so glad that you share that message, because I think it's important for people to understand the severity of these disorders. It's life or death. Usually it's not something that you can predict the outcome. And so having intervention with a professional treatment team is probably one of the best things someone can do for themselves.
Right.
And how would you say, just overall, in breaking the shame and stigma that's associated with eating disorders, and particularly with bulimia? I think because of how it's often portrayed in the media, it's even sometimes looked at as a disease of vanity, but really there's so many factors involved with bulimia. Um, how can a person overcome the shame that they might be feeling, or the guilt that's preventing them from asking for help or getting the treatment that they need?
Again, that I think that's a great question. One of the things that we do in treatment and is really working on the shame, right? And
Mhm.
I often tell clients where you're going to find a group of people that you can talk about your disease without feeling judged or criticized, and they're going to understand exactly what you're feeling and what you're going through.
Exactly.
So part of that is like information and understanding and the knowledge is a disease. There's
Mm,
treatment for it, right? And the other
right.
thing is being able to talk to somebody that is not going to judge your behaviors and is going
Mm,
to understand the amount of pain you're carrying and how you're dealing and coping with it.
mm.
So you can
Such a
learn
good point.
new ways of coping with the pain that doesn't have to do with binging or purging or exercising or having diuretics or using laxatives or any other destructive behavior.
Absolutely. Thank you so much for sharing that, Jeanette. And just in closing, can you maybe tell us a little bit more about Rebecca's House, or where someone listening to this who's interested can find out more information about this treatment center?
Sure. In Rebecca's House, we offer extended care and PHP and IOP. Everybody is welcome to call 24/7. The phone number is 1-800-711-2062. The website www.rebeccashouse.org. There's a lot of information also in our website. You can call, it's free, don't wait, and we're always here to help you.
Wonderful. Thank you so much again for just being with us tonight and sharing your expertise in the field. And like I said, we just really appreciate you as a clinician and just the contributions that you have made to the eating disorder community. So thank you so much again, Jeannette, for your time and for sharing with us about bulimia.
Thank you for your invitation. It was a pleasure.
Thank you so much. And just for our audience, if you're also looking for resources on eating disorders, please feel free to check out eatingdisorderhope.com for a lot of great information as well. And we have information about our upcoming Google Hangouts, and we will be doing a version of this in Spanish for our Spanish community in a couple of weeks. So we look forward to doing that as well. Thank you, everyone. Have a great night. Bye-bye.
Bye-bye.